Welcome to the season finale of Conversations of the Heart. As always, it is your boy T Till. We have a very special guest, a returning guest. It's been a while, but I've been waiting for this. Dr. Gabrielle Williams. She is a board certified primary care physician, and she is revolutionizing the healthcare business as we speak. She is the founder, CEO of an incredible practice. It's called Gateway Direct Health, and we will hear more about it. I know we heard about it before, but I want to hear updates. But for now, please welcome Dr. Gabrielle Williams to the show. Dr. Gabrielle, please. Thank you for joining the show again. It's been a while, and I know there's been a lots of growth. But before we get into that, for the people who don't know, for the
Mhm.
new listeners, give a little bit about yourself.
Sure. Season finale. I feel honored. And
Yes.
yeah, I feel honored. So I I have been rephrasing my I am statement. Hallelujah. I'll say I am a child of God. I
Mm-hmm.
am Haitian. I am
Stop.
a
Yeah.
wife, been a wife for 12, almost 12 years to my husband Kareem.
Shout out
I
to Kareem.
Yeah, I'm a mother of two. So I got a 7-year-old and a 5-year-old. And then I am a physician.
Mm-hmm. I love that. You wear a lot of hats. So from the last time we've talked, um, Gateway Direct Health, it seems like it's all the way up. So what's the update? I think the last time you were on the show, you were just getting off the ground, right? It
Right.
was an infant, in the baby stages. Um, Actually, I don't even know if it was birth yet. I'm not sure. But
Yeah.
I know that it was just in its infancy, right? So where are we now? Where are we now?
We are status post 1 year. We
Ooh.
are at a place of a lot of personal growth. I feel like that's something that should be shouted to the rooftop, that entrepreneurship, especially in the early stages, it's not about financial growth as much as we want it to be. It is about personal and spiritual growth. There are things
Mm,
that got to be kind of brought up out of us and rewired beliefs and thinking and
mm-hmm,
practices, especially from employee to entrepreneur.
mm-hmm.
I've learned that I am not a great CEO. I'm an excellent physician, but if it were up to me, if I didn't have checks and balances, this thing would be an LLC that was a nonprofit. You have to file. I be giving discounts and doing stuff for free all the time, which, like, not saying that that's a wrong thing, but in an LLC, it is not the right thing, right? Like,
Right,
if I
right.
wanted to be a nonprofit, then I should have made a nonprofit. So I'm so
Yes.
glad for my husband, who's the COO, and I think should be the CEO, but he's a COO. Again, checks and balance so that I can focus on being a physician while, of course, learning business because, I need to, but I can focus on being a physician while someone has my back to make sure that the business is profitable because we need it to be profitable business. So
Mm-hmm,
yeah, so it's more of an update on me and how
mm-hmm.
much growth I've had. But no, Gateway has been doing well. We are expanding. We closed enrollment for a little while because we got to where we needed to be, and now we're reopening. So now
Hey.
we moved to a new space. So I'm still customizing it to the way that I like. We are for a year we've been saying, okay, we're gonna do phlebotomy, we're gonna do labs in-house, we're gonna do procedures, and now finally we are. So we're able to draw labs in-house and do procedures. We've added a virtual assistant. And what else? Weight loss program has been doing well with people getting a lot of results.
Mm-hmm.
And I've been fine-tuning my niche and listening to the people who join as members, why they join. Because initially I thought this was going to be for uninsured patients with complex chronic conditions. I want the worst diabetics, the worst hypertensives, the worst, all of it. That's what I was trained to do, right?
Mm-hmm.
But who's attracted to this are people who are Black women, professionals and entrepreneurs who want convenience and who buy a physician that they trust. Like they're looking
Mm-hmm.
someone who makes them feel safe. And I think that is what I'm now like amplifying, that it's a safe space. Because what I found was when people say, "Oh, I'm healthy, I don't need a doctor, I don't need this," when they do join, you hear about the belly pain that's been on for 2 years. You hear about the blood in the stool. You hear about the nausea, the dizziness, all the things that they felt like wasn't worthy to go see the doctor except for once a year.
Mm,
Now they have a space where they could say, "Oh, yeah, actually, a lot more has been bothering me," and
mm.
that's who I've seen is attracted to this, and it's people with insurance. So they pay their insurance and the membership fee, which I think is great because you need hospital coverage and stuff. But I thought maybe it would be an undue burden. So I was like, okay, maybe uninsured are gonna come see me. Nope, it's the people who have insurance who know that insurance doesn't guarantee health care, but who are wanting health care. That's a long answer, but yeah, that's
Yeah.
here.
And one, I have to give you credit for this because when I first moved, right, and you know, the medical care system out here where I'm at, it's not the best. Um, it's very strained, and it's like months to see a doctor. And and I'm like, I'm not used to this. Where I'm from, it's like that, right? Like I don't wait, and I'm used to that. I don't like to wait.
Yeah.
When it comes to that, if I need to see you play, I got to see you,
Open
right?
that.
But here was very different. So I
Mm.
was like, what am I gonna do? So I literally thought about you, and I was like, are there any Dr. Gabrielle's out here? And I was like, I don't know. But I researched and I found one. And
Mhm.
I was like, oh, and met, did the whole consultation thing and awesome experience. Shout out to Dr. Isam. And but just an amazing experience, right? And but I wouldn't have had if I didn't really know that this type of stuff even exists. But
Right.
what you told me,
Mm.
like this is what you were doing, and people are doing this. And I'm like, people are doing this? Like they have practices like this, where you can
Yeah.
just pay for a subscription and go. And he was like, yes. And I was like, oh, okay. Lo and behold, you ain't tell no lie. You ain't tell not one. There's a bunch of, and to find one, especially one that looks like you,
Yeah.
right? And I found one and I was like, wow, and the experience and care has been drastically different.
Mm.
Um, and so thank you. Uh
Of course,
I
man.
I appreciate that. I
Yeah,
definitely
man.
appreciate that. And um, so for people who don't know, uh, what's the difference, right, between you, right, and a regular service provider that you have to go through insurance? Like, what do you bring that's different? I
Yeah.
know, but I want you to tell the people.
Well, the big thing that I see the difference that we are providing in the marketplace is truly caring for people, not just in word, but in deed.
Mm,
I think the slogan for a lot of hospitals, a lot of doctors' offices, patients first, patient this. But as a patient, listen, when you go in as a patient, you're like, this is different from what they're saying, right? What we find in the traditional system, doctors are overworked, so they're seeing 20, 25, 30 patients a day. So how are you gonna tell anybody about diabetes well in a 5-minute visit? And people are feeling
hmm
it. They're like, I waited so long for this appointment, then you made me wait in the waiting room just for you to be on the computer with your back facing me, typing while I'm talking, and just say,
hmm
oh, don't worry about that. How's your blood pressure? Your blood pressure. Okay, what's your blood pressure? Okay, cool. You need to take this medicine. All right, bye. That experience is leaving people frustrated and very distrusting of the healthcare system. And problem with that is if you don't go to the doctor, you don't have someone that you can go to you trust. You go to emergency room, go to urgent care, they don't know you. And so potentially things are missed. You're waiting a long time in the emergency room, and so people hate it, so they don't go to the emergency room. So now we suffering.
hmm
Now we're suffering. With a difference with membership-based practices or what we call direct primary care concierge, You have a physician who is about you, who is invested in your health and your well-being. Again, not just in word, but in deed. Who's going to follow up with you, who spends the time to talk with you, who listens, who's not rushed, who says, "Oh yeah, you don't have to just say one issue. You can talk about what you need to talk about. You're not
Oh
limited."
yeah.
You see what I'm saying? Like you'll feel like, okay, well, I mean, all of these things are important to me. How can we, how can I just drop it down to one? But you have a physician who's going to listen, who's going to care, but also spend the time to educate. I think in theory, in what we learn in med school, a lot of lifestyle changes, but because we don't have time in the traditional sense, in the traditional space, we have to prescribe first. We have to do this first, right? To meet
Mm-hmm.
metrics. Blood pressure got to be down. The diabetes got to be down. Instead of giving people the chance and the opportunity to work on healthy lifestyle. Sure, it takes a
Prevention.
while.
Yes.
Sure, that it'll mess up your metrics because the blood pressure is still a little bit elevated, but they're working on it, right? And you're able
Mm-hmm.
to educate and you're able to talk and make a decision together and say, Doc, I don't want to take pills. So then I can say, bet, I'm with
Mm-hmm.
you. What are you going to do to avoid it? What are you going to do to take care of yourself?
Mm.
Right? Like there's conversation. And we're accessible. So you're not waiting months for an appointment, days, maybe a week, but days usually. And you can access us afterwards. So you can text us, email, you need your labs. You don't have to. We're not telling people, hey, if you don't hear anything, then that's a good sign. No, we can send you your labs directly to you. We can talk about it. You're worried about a number. You can call up your doctor, right? Like text them real quick, email them. Um, hey, doc, I need a referral. Hey, I need this form filled. You're not waiting months for that. You can
Mm.
get done much quick, like
Mm-hmm.
convenience, accessibility, hassle
Mm-hmm.
free. You ain't gotta be on the line 20 minutes, with the the dial tone, and then it drops. Even get to somebody wasting time. Like that's what I feel. I know that this is what people envision as great healthcare. I know that this is what they expect, and I'm so glad that through this model we can provide that type of care and not the traditional. I mean, everything has its place, right? Some
Yes.
people will say, well, membership practice, you guys only see a few people, so you don't serve everybody. Sure, you're right. But the problem is with having fewer healthcare workers and having a larger population, no one is, like there's fewer people who are getting true care. Like even if you're seeing a doctor, are you getting the true care that you need?
Right. Right.
Right? You should
Mm-hmm.
incentivize more doctors to go into the membership model so that they are happy, physicians are happy, patients are like members are happy. Who knew that there was a win-win? Well, there is. It's
Yes.
called Gateway Direct Health. Hello.
Absolutely. And the one thing I've learned about this model of health is it's preventative too. And you can test for things without having to go through insurance. So I can test for things that if I have any concerns, I can test for it without saying, "Hey, I'm waiting until it's almost done." Right? Like I'm almost done now. Now
Yeah,
I can test for it, right? It's like, it's like there are things that now I've learned even about myself, certain blood tests that we can do, right? Certain types of full body scans that I've done, right? Where
yeah,
it's preventative, where it can test for early detection of strokes and this and that. Like, and I'm like, oh, I like, see, this is my kind of talk. Like, I like this, right? Because it can prevent things, right? So instead of being just reactive, right? We're just being preventative, right? So I think that's the thing of just reacting to a problem. It's, hey, before it gets to this, I want to test for this, right? Early and see. And
yes,
I'm like, man, like that's the kind of care I like. And sometimes it just gives you a different type of mind where it's like, oh, my mind's a little bit more at ease
at ease. Yep.
with stuff like this,
Yes,
right?
peace.
And like I said, there's an education piece and a care about this, right? Where I think my first visit with my doc was like 2 hours. I said, excuse me,
Yeah,
2 hours? Go, yeah, we're gonna do your physical and we're gonna have talk. And we're gonna have a talk. And
yeah,
I'm like, okay, did the physical thing, cool, no problem.
yeah.
And but then just the conversation, like diving deeper into health
Yes,
goals,
yes,
things that I'm concerned about,
yes.
right? And it's like, yo, nah, she really. she care about me.
Yeah.
Like it's like
Just from
saying
the
like
first
she
conversation.
really care about
Listen.
like for real. Like I'm
Yeah.
like, okay. And the accessibility, I think, is priceless. And you can service anyone anywhere. Like you can service anyone across the United States, if necessary, right? So if you have someone who's based where you're at in Atlanta and they travel somewhere for 2 weeks and they get sick, they can call you. You can call in a script. I said, hey, I'm sold. What you want from me? You know what I'm saying? Like, and that's the thing, I think that convenience piece is just knowing like, hey, this person has my best interest at heart. I'm not just another number. I'm not just a medication, right? It's just because that's the thing. They push, all right, so medication here, medication here, medication. It's like Oprah, you get a medication, you get a medication. Everybody gets a medication. And I'm not against medication, right? What I but what I'm saying is if there's a lane to prevention, health, right, where you could say, I want to do this naturally, like, do I have time to?
Yeah.
And maybe this way we can catch things early so that you can do it early. But most of the time, by the time people catch things, or by the time doctor's like, well, it's too late. We need to do this
Right. Right.
or else. So now it's like, thanks. Right. So I love the work that you do. So in your expert opinion, what are you seeing out there, right? Especially with patients, right, that is making people the most sick,
Yeah.
right? To where you have to say, you know what, we have to stop this. We have to attack this. We've got to get better. Like, what are you seeing out there?
I know it's a cliche, but the hustle and grind for an American dream, that bow don't exist. The stress,
Mm,
the stress, and the stress I have
mm,
seen contribute to insomnia, so lack of sleep, not eating consistently, not exercising, putting the job before their own self-care or their time with their family. So
mm,
then what do I see on the other end? I see depression, I see
mm,
anxiety, I see high
mm.
blood pressure, I see
Oof.
diabetes that's uncontrolled. We see heart disease, heart failure. We see um chronic belly pain and chronic nausea. Like
Mm,
I'm seeing a lot the manifestation of our mind not being healthy coming out physically. And I know that people are like, oh, well, then you're minimizing my symptoms. I am not. If anything, I am trying to maximize the root of the cause,
mm-hmm,
which is a stress that we feel like we have to sacrifice our time, our energy, our youth, our family for money, right?
mm,
For things, which I'm not saying anything's wrong with that. However, it when it starts impacting our health and
mm,
our multiple aspects of health, our social, emotional, mental, physical,
mm,
we got problem. Like that's a problem. And so then and we also lack appreciation of where we are and don't understand the power of that what we have to
mm,
structure our life the way that we want to with what we have. We can.
mm,
Is it going to take sacrifice? Is it going to take reimagining what the perfect life or the American dream looks like? Yeah. Is it going to take not saying, oh, I want to look like someone else and making it your own? Yeah.
mm,
But we're
mm,
like, we feel like we have to do all of this. But then I'm like, for what? And
mm,
unfortunately, it starts wearing down on us, right? I don't know if you've heard of like people who work many years and when they retire, that's when their body breaks down.
mm, mm.
And that's like the common theme.
Wow.
And yeah, I think it's just years of delay. Oh, I'll rest later. I'll sleep when I die. I mean, why? It's
Now
like,
listen, you speaking to me because when I was in my 20s and early 30s, that was my motto. I sleep when I'm dead. Like that was from like that's the hustle. Like that's the thing, especially where I'm from. You know where I'm from. So it's like you hustle so much and it's like, yo, like I sleep when I'm dead.
yeah,
But I realized, one thing my mom always told me is stress is a silent killer. And a lot of times like people don't believe that, but sometimes like when you realize how much stress affects you physically and you just think one day, oh, I'm just getting sick or I'm just something happened. And it's like, yo, what's the root? Like, because you hit it right there. What is the root cause?
yeah,
Stress,
Yeah.
stuff going on with your mental health.
Yeah.
Things are different, and as costs rise, because I already know people gonna say, you know what, Dr. Gabrielle, but what are we supposed to do? Like, the economy, everything is up. We're supposed to get money. Like, how am I supposed to raise my kids? Like, how am I supposed to put my kids through school? How am I supposed to,
Mhm.
everything, right? And people also, when we talk about stress, even if you don't have kids, people are stressed out nowadays, where it's like they people are dealing with, layoffs.
Yeah.
People are just companies just laying off left and right,
Yeah.
and then it's like, well, what am I going to do? Right? The rent is not going to stop, right?
Correct.
What am I going to do? And most people don't have what? Savings. They don't have something because things are so high, right? It's a lot of contributing factors that's stressing people out, right? And so it's just like, what is the answer,
Hmm.
right? And it's a tough thing to answer, right? Because I understand where we are as an economy, right? And people are also dealing with, I'm not where I thought I would be at this age. I'm dis I'm disappointed,
Yeah.
right? Like that grief of
Hmm.
feeling like you're failing at a
Yeah.
certain point in life because you imagined it to be different than where you are right now. And that's a tough pill for people to swallow, and it's very stressful, right? So
That's
I don't know what the answer is. I mean,
listen.
working out, of course, right? Therapy.
Of course. Yeah. That's
You know me, I'm an advocate for that.
for sure.
Therapy helps me. I'm just saying, therapy helps a lot. Working out, sure, but it's just so much going on. I don't know
Yeah.
where do you go from there?
Definitely slowing down and taking that time. Let's say if you are laid off, what do you truly want? Is it really like what do you truly want and how are we going to get there, right? Like this is not forever. We know that the economy does this. Like that thing swings. And so I think that the Lord can use this time for people to say, okay, what do you really want? What Lord, what do you want me to do?
Mm,
How am I going to do it? How are you going to make a way? I know for me, I know not everyone believes, right? But I know for me, I know Jesus is the answer because he said that if we seek his kingdom and his righteousness, all things will be added to us. And I'm
hmm
going to have to believe that even if I can't see it. And again, that's what I've been working on this year
hmm
of being, of aligning with his truth despite what I see because I'm with you guys. Listen, it was tough. This year business is growing, but still it was tough, right? Like
hmm
I was operating from a place of survival, hustle, grind, go to every event, go to, like
mm
things on and but then my husband was like, you're not really spending time with us, but I have to. I have to do this for the family. I'm doing it for the family.
I'm doing this
What
for
are the kids,
you.
what the kids gonna remember?
Now
What are the kids gonna remember?
you're not there.
I wasn't there. And that's what I think of. I talked to my dad and he was like, "Yeah, sorry, I wasn't there for you. I was trying to make ends meet." And I was like, "Wait, I'm repeating the pattern
It's like, mm,
on a different level, sure, but I'm repeating the pattern and my kids are going to remember mommy wasn't there. That's what they're going
mm,
to. So
mm,
I had to take a step back, right?
mm,
And kind of reevaluate, okay, what am I doing here? Because when you start something, like it's hard to pull back later. So if I'm starting the business, hustle, grinding, and bending all kinds of boundaries, I'm gonna have to keep that up or deal with the consequence, right? Which sure, you can always pull back, but the consequences are gonna be different. So when you talked about like savings and all this, I'm like, okay, it really is prevention. Again, thinking about what you want and
yeah.
then start making decisions that align with those goals, that align, like it has to align. That has to be like your place, your anchor, so
Mm,
that when you make your future decisions, you're like, okay, this is what I saw for my life. This is what I wanted for my life. So yeah, that's for me, my like what I've learned this past year again about personal growth and like making decisions from a place of what I said my goal is and what I want to do and
mm,
making and they're preventative decisions, right? So that I won't have issues later.
Powerful. So here's the thing.
Mm.
Um, this is the This is the season ending episode. But what I want to do um, is I also want to begin season six with you. I want this to be a part one of a part two. Well, yes, fine. If you're open to it,
Of course.
right? Top of the year, people's gonna have their New Year's resolutions. We'll pick a time, because there's a lot of things that I want to dive into, and I want more time, right? I want more time, and I think who better, to start off the new season with, talking about health, wellness, and things that I really want to dive into a little bit deeper.
Yeah,
Um, because there are lots of things that are important, that I think that people can benefit from all of your wisdom, knowledge, and understanding of the medical industry, but then also people,
yeah.
right? And you are a people person. Your bedside manner, is incredible. So, I think people can learn a lot from you, right? As we're going into 2025, like we just talked about with our expectations, right, of ourselves, right? Stress, things going on, right, and how that can affect um, your health. And I want to dive deeper into those things, how it could affect women and men,
Yeah.
right? And so, I do know you have to get out of here. So for the one thing, I just want to thank you for coming on the show and closing out this season with me. And looking forward to beginning season six with you. And we're going to dive a lot deeper into some topics that I know a lot of people really need to hear about. And all the work you do. Thank you. And I
Oh,
always
thank you.
appreciate you.
Yeah,
Um,
man. You're a T-tail. But yes, I'm happy to, and we will dedicate that time. I got you. Dedicate that
mhm.
time deeper for sure.
Absolutely. All right. Ladies and gentlemen, this has been another episode of Conversations of the Heart. Please go check out Dr. Gabrielle Williams. If you are in the Atlanta area, Dr. Gabrielle, tell them how to get in touch with you, how they can subscribe to Gateway Health and go from there.
Yeah, so you can find us at gatewaydirecthealth.com. You can email us at info@gatewaydirecthealth.com. And of course on social media on all platforms at Dr. Not Miss. So DRN.NOTMS.
Yes, go follow, check it out. Listen, as a person who has this kind of healthcare, you won't be disappointed. It is incredible. Please support her in her ambitions of trying to revolutionize the healthcare system in the way that she knows how.
Yeah.
And she's just a great all around person, just to talk to. So I know if you're a great person to talk to like this, you'll be a great doctor to talk to as well. So everybody, please reach out, share it, share Gateway Health and tell a friend to tell a friend. But this has been the end of season five. I've enjoyed this ride again for another season, and I look forward to seeing you guys and all the great things that we're going to do in season six. Peace.